Hi, this is Tatiana Foltz, and I am recording a non-live version of COVID-19 through a trauma-informed lens. And first, I want to thank everyone who kind of came to the live version, the kind of rougher version. I really appreciate that, and acknowledge that a little bit of my perfectionism showed up and kind of won to create this re-recording. So in that, I really want to thank everyone who's taking time out of their day to acknowledge that COVID-19 is a difficult dynamic. It is hard to look at. It is hard to work with, work around, and live with. However, your life has been impacted, your work, your family. So just thank you for this time and space. This has kind of been mulling around in my mind, and I shared the idea of COVID-19 as a global trauma with clients, and it seemed to resonate with them. And then a great Instagrammer, the underscore queer underscore counselor, put up a Instagram that just said COVID-19 is a communal trauma, and that really resonated and led to this discussion. And just acknowledging that a pandemic, by definition, is traumatizing, and that we are experiencing something so communal and so isolating, and acknowledging that currently where the field is with mental health and how much we are honoring and acknowledging the impact of trauma. It's a very specific time and place. I know in my world and in my community, and I'm sure it's the same for many of us here. So, trauma is kind of a lot of trauma, and a lot of that word in general can be thrown around. The framework that I'm kind of working with is the one of Judith Herman, which is something where you are something you are not in control of, that is overwhelming, that induces fear and hopelessness. That's a paraphrase, of course. That is a paraphrase of her book, Trauma and Recovery. She really, that book and her work and many other traumatologists' work kind of pushed us into the modern framework that we've developed, that the field has developed, the trauma-informed lens and the modern ideas of trauma and complex PTSD. So that's a framework, and obviously COVID-19 fits into that. It is something we don't have control over. If we did, it would be over today, and we'd all be able to run around and hug each other as much as we want to and as much as we consent to. But that's obviously not the case. And it is overwhelming. It does induce fear and hopelessness. So some things to be mindful, or some symptoms that show up with trauma. I'm going to use the framework of the DSM-5, that there's kind of three main clusters that our bodies and mind respond to trauma with. And those are found PTSD. I'm not diagnosing anyone. I'm not saying we're all going to get PTSD from surviving COVID-19. I'm just going to use that as a framework to discuss what it looks like when we're interacting and reacting to trauma. So the first kind of cluster is avoidance and numbing. So this can include denial. We see this with some people going, yeah, I'm still going to go to church. I'm still going to go to Easter Mass. It's not going to be that big of a deal. I'll still go to the grocery store every Sunday like I've done the past 20 years. These types of things is kind of an avoidance of the subject. It can be construed as denial or repression even, depending on how it shows up with the individual. Numbing also includes like diving into those TV shows, binge watching, video gaming, of course, all these things can be coping skills also, but just any coping skill, it can have this kind of healthy range and these unhealthy ranges. Like eating should be happening right now. And then there's going to be this supportive range of eating. And yes, some of it's going to be emotional. Some of it is going to be reactive. Oh, I just read the news, so I want chocolate, or I want a glass of wine, these types of things. And then there's going to be these other pieces, right? Where, oh my gosh, I don't have control over what's going on outside. So I want to have control over what's going into my body. And that might be under eating or overeating as one of the coping skills. Additionally, and obviously sometimes eating, drinking, etc., can be part of that numbing and that attempting of coping. Additionally, there's going to be potential for re-experiencing. There's been news articles about how children are playing doctor and playing ER, making sirens for their cars and their Hot Wheels, saying they're ambulances, being more interested in medicine that we're already taking or they're taking. And, but that play, and sometimes it's very rigid play. We see that with individuals that have been abused, especially sexually abused, is kind of an example that is commonly used with that re-experiential play. So that impact that happens to our youth. Also, we might be watching more ER videos to kind of process the things that we're seeing in the news. Our worries about how our healthcare system is showing up and being under supported. And additionally, nightmares. I know a lot of people having nightmares about being ill, not being able to find a hospital, nightmares about being healthcare professionals themselves, and or about their last shift or their last work with a boss, that centered around the pandemic. So just acknowledging that these are some things that can be showing up. Additionally, hyperarousal. So that's like being easily able to be startled, kind of the, very loaded word, highly polarizing word of being triggered. That kind of shows up in that hyperarousal. Other ways that people react to that hyperarousal can include being very nervous about walking past people. I walk with someone that lives in my house, and I notice that their shoulders tense up even if we see someone a long length of a block away. And I know I get nervous if someone's passing me on a bicycle, even if it does sound like it might be 6 feet away. And even if I do some of the math of the actual risk of being infected by, community member number 5 on a bicycle, I still can have that tension. Additionally, some engaging with news, very, very regular, can be a reaction to trauma. This idea of, if I have enough information, if I know where it's showing up, I can avoid it better. I can react to this trauma in a stronger way, which obviously this is an invisible or a less visible event, it being a virus and on that micro scale. So obviously there's some calculated risks we make and some calculations we make in knowing that data. However, knowing day to day how many people have died from COVID-19, or how many people are in the hospital from COVID-19 from the county, is that helping me make the decision whether or not to go to a certain grocery store? Is that supporting me in my plan and my risk management and my harm reduction with how I engage with shelter in place? That's something to be mindful of especially during this time. And so that kind of goes into some of the coping skills, some of the tools that are recommended and that I myself have engaged with, and I've kind of problem solved with clients around, is being mindful about our media exposure. There's only so much you can witness, nurses using garbage bags, body bags being taken out of hospitals and put into spaces. There's only so much you can acknowledge that, yes, people of all ages may be passing away and are passing away, of course, disproportionately certain ages and certain ethnicities, before it takes a toll. And being mindful of how often what our physical response is to the media, and what is driving us to wanting that information so often. And as a data nerd, like, I understand that impulse. There's some times when I feel like if I research something enough, I can master it. And that sometimes does make sense, and sometimes it just, nothing is 100%, right? And especially when we hear about these things about people walking around being asymptomatic, or people not having access to tests as much as other people, that can adjust how much information we actually have access to. So being mindful of our reaction to media, our frequency, our intensity when we interact with media. Again, also acknowledging what level of control we have over certain things. So there's what we have control over, what we have influence over, and things we don't have control nor influence over. And that's most of the universe, right? But what we have control over is maybe how often we wash and or sanitize our hands, how we engage with the grocery store or delivery folk, what kind of risks we may be taking personally. Things that may be under our influence is what risks people in our household are taking. Of obviously, some people we're going to have less influence over than others. Their children we may have more influence over. How often they wash their hands, take off their shoes at the door, etc., versus, let's say, a roommate, or let's say a neighbor. So being mindful about those things and how much energy and rumination that we are engaging with, and how much reality testing we're acknowledging. And I think it's worthwhile to acknowledge that shelter in place in and of itself is a harm reduction method. We're not going full-blown lockdown like some certain regions and countries are. We are, many states, and I say we because I'm in California, are engaging in shelter in place, which means that we can still go to the grocery store. New York is utilizing masks and mandating masks for being in public, and California at this point is not. And those are all different levels and methods of harm reduction that COVID-19, the deaths, the illnesses, the impact that it's having on our communities is the harm, right? And ideally, the reduction is shelter at place, PPEs as much as possible to as many people as possible, and acknowledging that there's no foolproof way to make this pandemic zero overnight. So in that framework, I think it's beneficial to also look at this. Part of this harm from this pandemic is also taxing on our emotional labor, our physical labor, our finances, and really, really honoring that no one knows a foolproof, smooth, perfect way to get through a pandemic like this. There is no modern history for something like this, and for how much, a pandemic during the age of the internet. So just being mindful of that there's no perfect way to move through this, and there's no perfect way to be a teacher, a home educator, doing your job, working from home, possibly for the first time ever, and moving through the world the way that it's currently set up, with certain businesses very much closed, doctors, some being fully shut down, some being only emergency. No one is a master at this, or has this fully fleshed out what this can look like. So being kind to ourselves during this period of time. And that means moving our bodies and being connected to our bodies. Many people who have chronic illness, chronic pain, or who have been harmed through their bodies, traumatized through their bodies, that this is going to be a little difficult, but or have other nuances. So being mindful that not every meditation is going to work for every person the same way, and that movement of body is going to look different for different people. Some people, it's going to be a stretch in a chair, and that's what they have access to. Some other people, they're going to go for long walks and wear masks, and that's what they have access to. Other people are going to be able to run on their treadmills at home, do an hour of yoga, and just acknowledging that we're all going to have different levels of access, just like we did before this pandemic. But being aware that this is also a stress on the body, because part of why we're susceptible to this virus is because we do have bodies, and those bodies do get ill. And through the trauma-informed care, I'm going to be sharing my screen. And there's a great handout that Oregon Trauma Informed, I think it's called, or Trauma Informed Oregon, I apologize. They created this great handout that goes through the precepts of trauma-informed care. And they cite, concepts and guidance that's from SAMSHA, which is kind of a branch of NIH, and I'm sure DHHS is involved in that also. But anyway, I really like this visualization, and many a times as service providers and as communities, and I know for myself as someone who is white and has white privilege and has English speaking privilege in the United States, many times, because systems are developed by people that may look like me, I want to acknowledge that sometimes we put culture, historical, and gender issues last, and I want to put that first, because culture, and that includes gender in our histories in my framework, is the lens that we look at all organizations, all symbols, all experiences through. is our own personal histories, our community's histories, and the mainstream culture's actions towards those intersections and those identities. So individuals who are part of communities that have been harmed by the medical industry historically are obviously and rightfully are going to engage with that system differently than other folks. And I really appreciated, there's a podcast called Irresistible, and they had kind of a round table for people who work with and who are community organizers, cultural workers in justice, in disability justice. And I really appreciated that they acknowledged that individuals who are in CRIP organizing, people who are reappropriating the word cripple, and or just disability justice, healing justice, disability rights movements, they have a lot of information that people who don't have chronic illness and don't have the constant fear of having to go to the ER don't always feel like they need to engage with. That is not always a daily engagement for them, right? That's a privilege that they may have. And people who do that kind of work and who do access work now have a wisdom other people are tapping into. So I think that movement and those organizers, I'm grateful that and hope that we don't lose that wisdom and we don't go back to normal with ideas about access, without ideas about working from home, ensuring and understanding that engaging with the medical system can be traumatizing in and of itself. Medical trauma is another subtype of trauma. So I just really wanted to acknowledge that cultural, historical, and gender dynamics that show up whenever we engage with systems, especially medical systems. And other things to consider when we're in our communities, with ourselves, and with our organizations. When I did I'm going to stop sharing for a second. And when I did the live version of this, many of the people were healers and were health providers. In that work, many a times we're engaging with people who have been traumatized, who have been hurt. And so this is going to be helpful not only in professional work, also in our own communities. I've really appreciated seeing how some sex worker organizations are honoring that, obviously being in close contact with people, that their industry has been impacted, disproportionately, sex workers being vulnerable on other access. Sex workers are disproportionately likely to be queer and or disabled and or be people in need of housing or be at risk of losing housing. So the fact that I've been seeing town hall meetings, mutual aid focused specifically for sex workers, I've really appreciated that. And that obviously is something that shows up with utilizing a trauma-informed lens that includes transparency, peer and mutual support, collaboration, and ensuring that people know their choices, that they can have a choice and a fully informed choice about how they're going to engage in their work. And so that can look like, and I'm looking over here because I have a little outline over there, that obviously is going to look differently. But let's say that we're in our own homes and we're working with our family and maybe roommates, or maybe we're even working in a safe house. where it's more communal living or a foster home. And that can really help us with the transparency of why supporting kids understanding and ourselves understanding why we're not engaging in school the same way we used to. Um, Supporting that communication, and that might be why some people are being inundated with emails from schools and or other businesses, is it may be an attempt to try to support transparency, that safety piece, and empowering choice. And that's going to be something that we can continue to utilize. I know myself as a healthcare provider, I'm going to continue to support people having access to telehealth and video conferencing services well past the point of shelter in place. And I think that I would hope that's something that we all consider. Additionally, having town hall meetings, having multidisciplinary team meetings, having those in place is something that our foster care system has instilled. And I think that that's fantastic. And that's something where everyone sits kind of down at a metaphorical table, sometimes a literal table. Obviously, that's not always an option at this point. And it never has fully been an option for all of us. And that everyone comes to the same place, same time, and they're able to kind of discuss those issues of safety, be transparent about what's a hope, why people are doing the things that they're doing, and offering peer support as something that can be very powerful. I've done a lot of work in the anti-trafficking movement, and seeing survivor leaders and peer support showing up in different agencies around the nation and around the globe, and creating a survivor leader movement is very, very powerful, and has been very, very powerful in disability justice, healing justice, rights movements is major. And honoring, and a lot of this obviously is work and working together. Additionally, and lastly, I'm just going to quickly mention that trauma and grief go hand in hand. So grief, there's kind of 5 major pieces, acknowledged pieces of grief, and they are not linear. They are not steps towards acceptance. They can go kind of cyclical and go back and forth. So those are denial/shock, and that can be included in that numbing piece that I talked about that's common in trauma response. Depression, bargaining, depression, and acceptance. And we're going to have grief over different pieces of this. We're obviously going to have grief when we lose people. We're going to have grief about the ideas about our own bodies and what health looks like. If and when we get sick with COVID-19, if and when there's medical shortages. Obviously, this has shown up with people who work in the ER. There's grief, real grief around their own safety, and understandably. And some of that will show up in anger, and anger is appropriate. And sometimes anger can be utilized and should be utilized to create dialogue and to create movements. And that is an appropriate response. And how we utilize anger can, of course, be supportive towards our goals. And sometimes it can be harmful too, right? If we were to project that anger onto loved ones, if we were to mismanage that anger and put it onto ourselves, it can show up just like any other feeling. It can be supportive and beneficial, and it can be harmful. And just acknowledging we're going to have different levels, different types of grief at different points. Grief about our paychecks, grief about our workplaces, grief about our ability to go into the office and those communities that we've built in those common spaces. And those can be at all different emotional stages and all emotional stages at once. So being very kind with yourself. Another thing, being kind with yourself around your grief and your trauma responses. A fantastic book for anyone who is observing trauma and working with and through systems of oppression, and witnessing trauma. And I would suggest that that's a good portion of people. Is the book Trauma Stewardship. If you find the book, it has clouds on it, and its title is Trauma Stewardship. And it talks about the common responses we have to trauma, the ideas of burnout, and how to better manage and be insightful and be proactive about our trauma responses. And so that's going to be one of the last resources I kind of speak of, but please be mindful of the resources you already have, whether it be your peers, your supervisors, your family, your friends, your online communities. I know I've been engaging in online communities more than I previously had, whether that's been going to virtual drag shows, going to healing circles, like meditation circles, even just having brunch with friends while over Zoom. I want to encourage, taking inventory of our resources and knowing which ones we feel most supportive by and which ones we feel drained by afterwards, and being mindful of that if we're able to accommodate those and navigate those with purpose. And also knowing that we're going to make mistakes and we're going to get insights from this that we won't even know about until years past this, and being kind to ourselves during this. And that includes being kind to the parts of ourselves that are grieving and that are traumatized. And I'm going to share my screen one last time, just to share my contact information. If anyone wants the recording, if you're probably watching the recording right now, but if anyone wants a link to the books that I referenced or has questions about some of the things that I discussed, I'm going to be putting my contact information on the screen. And here we go. One moment. And this is my contact information from my website. My website's at the top over here. This is my address. And obviously all my appointments are remote right now by appointment. This is the best email address to get me at, and that's my work cell phone for texts. So feel free to reach out. Definitely reach together with your own community, and be kind to yourself, stay safe as much as possible, acknowledge that there's nuance in learning in all of this. Thank you again for taking time out of your day and out of this difficult situation for yourselves and your communities. And I hope this was a big help. Okay, bye, take care.